Thank you for tuning in. You're watching COVID-19. I'm Min Sanhee. Just after 2 days of hovering in the 200s, today, Korea's daily number of infections has surged past 300. Authorities yesterday had described the situation as the calm before the storm. And now it appears that the storm may be here, both metaphorically and literally, amid the presence of Typhoon Bavi. But before we delve into that, here are the latest numbers on the pandemic with our Kwon So-ah and related news with our Hong Yu. So I hear that we have more than 300 new cases on this Wednesday.
Yes, unfortunately so, Sunny. And also more than 300 were local cases, so with around 3/4 of the new cases, again, in the metropolitan region.
So if this trend persists, I assume that level 3 of social distancing measures may become a reality.
Right. Authorities are saying if the numbers do not flatten, the highest level of social distancing may have to be implemented. To not let that happen, however, officials are continuously calling on citizens to abide by the current existing social distancing measures at level 2. And they have also been announcing separate measures to boost the effects of the existing measures. One of those being the closings of schools beginning today, which our Hong Yu will go in depth later. So let's hope these measures will take an effect and that our numbers will go down. This Wednesday, we have 320 new cases, raising the total to 18,265. The death toll stands at 312, and we have more than 3,580 people in quarantine, and over 14,300 people have now fully recovered from the disease. In the meantime, since last Wednesday, we had over 2,500 cases here in the country. We've been going up and down from the 200s to the 300s, and the average of this 8-day graph stands at 313. Let's now move over to our map. We see most cases occurred in the metropolitan region, around 240 cases in total here in Seoul, Gyeonggi-do Province, and Incheon. But what's also a concern is these sporadic cluster infections across the nation. Some of these places now have risen to double digits, like Gangwon-do Province and also Jeollanam-do Province. That is, it should be, yes, here 13 in Jeollanam-do Province. So it is a concern that these cluster infections are spreading across the country. And now on the international front, the total figure has surpassed 24 million with over 823,000 fatalities and a little less than 16.6 million recoveries. And while South Korea has the 75th highest number of COVID-19 infections in the world, now let's take a look at figures at countries which have exponentially high numbers. The U.S. is expected to surpass 6 million cases in a day or two, as it has been seeing 40,000 cases on a daily average, which is, however, lower than 20,000 cases lower than it has been seeing just last month. Meanwhile, the gap between Brazil and India is narrowing because India is seeing more than 60,000 cases on a daily basis. Let's move over to other parts. Similar figures in Mexico and Colombia when it comes to the total number of cases, but a much higher death toll here in Mexico. And then Iran is also still dealing with resurgences. It is a country we will connect to later on. It is seeing some 2,000 cases on a daily basis. And I will be also back here later after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Right, back on the local front, the academic arena here in the metropolitan region is going online starting today for roughly about 2 weeks. I have our Hong Yu here in the studio with more on this recent effort to stem the spread. Welcome, Yu.
Hi, Sunny.
Right, Yu, let's begin with the enhanced social distancing measure for schools here in the metropolitan region.
Sunny, schools in the capital regions such as Seoul, Gyeonggi-do Province, and Incheon have now switched to online classes. They include preschools, elementary, middle, and high schools. One exception is high school seniors, who will continue to take offline classes to help them prepare for Korea's college entrance examinations, which are set to take place less than 100 days from now. The transition to virtual learning comes amid efforts to contain the renewed COVID-19 outbreak that has struck the nation, particularly the Seoul metropolitan area. Schools have been hit as well, with around 193 students and teachers testing positive for the virus in the last 2 weeks. The Ministry of Education said it will continue to monitor the situation with health authorities before deciding whether to extend online classes. Until further notice, classes will be held virtually until September 11th. Small schools with less than 60 students, however, will be able to choose between online and offline classes, depending on the outbreak situation in their respective regions.
Right, The switch to remote learning, though, could be a problem for working parents, especially those who have children that are very young, kindergartners.
That's right. Many parents were hoping that things would go back to normal in the fall semester, but now they're actually facing a difficult juggling act of trying to make the ends meet and trying to take care of their child at the same time. In response, the Ministry of Education said it will provide childcare services for families that need them. They will include lunch catering and after-school classes. To help smoothen the transition to online classes, the ministry will bolster the necessary infrastructure and learning content. Let's take a listen.
We expanded the simultaneous login capacity for e-learning centers to 3 million students and established a monitoring team for each platform to check for system errors. We will continue to provide educational content through the educational broadcasting system.
The ministry will also rent notebooks, tablet PCs, and other devices for free to students that need them, as well as free internet service for learning purposes until December. Those that need extra help in digesting what they have learned online will be able to take after-school sessions.
Right, well, that's good to know. Now, there are also concerns of possible infections at cram schools. How are authorities addressing these concerns?
Well, Sunny, the head of the Gyeonggi-do Provincial Education Office, Lee Jae-jung, said the province had already conducted an inspection on more than 30,000 private academies from early February to mid-August. That is 92% of all academies in the province. But the province has gone further by limiting the number of students allowed at academies that have a maximum of 300 students enrolled. As for bigger academies with more than 300 students, they have been urged to suspend operations in line with the government's strengthened disease prevention measures. The Gyeonggi-do Office of Education will continue to inspect academies to ensure the safety of students.
What about the annual scholastic ability test? Now, I understand it's been rescheduled for December. Will it proceed as planned, though?
This year's College Scholastics Ability Test, or CSAT, is scheduled for December 3rd. The date has already been pushed back because the exams are usually held in November. Now, the question is whether we will see further delays when the country's social distancing level is elevated to level 3 from the current 2. And what's the plan in case students have to take the exam when social distancing guidelines are at their highest level? At the moment, the Ministry of Education is doing its best to avoid rescheduling the exam by quickly containing COVID-19. The Minister of Education has also mentioned the need for a Plan B for test takers. The details of this Plan B have not been disclosed, but it could involve allowing students who are either in quarantine or have tested positive for COVID-19 to take the test in hospitals or in a separated facility.
I see. All right, I guess we'll have to pray for the best then. Thank you very much for that coverage. You hope to see you again soon.
Thank you.
Right, it's time now for the regular afternoon briefing on COVID-19. Since August 14th, Korea's daily infection numbers have been in the triple digits. Following a drop to the 200s this past Monday and Tuesday, the number of new cases on this Wednesday stands at 320, as our Kwon-so mentioned, following a disturbing trend that began last Friday and well into the weekend, with Koreans recording almost 400 cases this past Sunday. Now, accordingly, debate continues over the possibility of further raising social distancing guidelines to level 3. Meanwhile, as part of the latest efforts to stem the spread, the academic arena here in the metropolitan area for kindergartners, primary, middle and high schoolers has been ordered to go online, as our Hong Yu mentioned, starting from today until the 11th of September. The only exception will be extended to seniors in high schools who can partake in a hybrid arrangement of both online and offline classes under stringent safety measures. Now, the entire country is under level 2 of social distancing guidelines. Again, do remember that for those of you here in the capital city, the number of people who can gather for a rally has been restricted, that is, to 10. Now, aside from that purpose, all other gatherings indoors can host a maximum of 50 people, while outdoors, the maximum number stands at 100. Under level 2, professional sports games can be held, but in the absence of fans at stadiums. Now, with regard to measures for the academic arena, as I mentioned earlier, they have been toughened for roughly the next 2 weeks, requiring all schools to go online here in the metropolitan region, while those in other regions can adopt a hybrid approach. For those in private as well as public workplaces, teleworking has been advised as authorities urge for efforts to limit physical contact to curb infection. Those at workplaces or even at home are also being advised to ventilate frequently to allow for a healthy flow of fresh air. Remember that is, when you're using the air conditioner, you need to ventilate your space at least once every 2 hours. Also, do avoid dining out and do opt for takeouts instead. And for those of you in the metropolitan area, do refrain from unnecessary travel to other parts of the country. Now, we are still waiting for that briefing to commence. It is supposed to start at 2:10. We're still waiting for the head of the KCDC, Chung Eun-kyung, to give us the briefing. Right, well, as the podium remains empty right now, perhaps we can take a look at today's numbers of infections this Wednesday here in Korea. As Kwon-soo mentioned at the start of the program, we have 320 new infections, raising our total to 18,265. Right, the briefing is about to start, I hear, so we will come back to you, of course, after that particular briefing to give you a summary. No, I just heard that the briefing is yet to start, so what we'll do right now is perhaps take a look at the level 3 social distancing guidelines, which have not yet been implemented, but there is debate that those measures may take force if the numbers of new infections here in Korea continue to rise. Now, should level 3 social distancing guidelines go into effect, a maximum of 10 people will be allowed for all gatherings, be it outdoors or indoors. All sports games, professional games, including football and baseball, will be suspended. And high-risk facilities, including the 12 that we've mentioned previously, that will include buffet restaurants, crammed schools of more than 300 students, singing rooms, as well as internet cafes, will be asked to suspend business, as is the case right now under level 2, of course, of social distancing guidelines. The briefing is about to start. I'll come back to you afterwards with our Kwon-soo.
First of all, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of August 26th, we have a total of 307 new local infections and 13 new imported cases. The total caseload now stands at 18,265. 82 more people have been discharged following full recovery, while 3,585 people are in quarantine. There are 43 patients with severe or critical conditions. We had 2 additional fatalities. The death toll now stands at 312. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the updates of the domestic transmissions. Related to Sarang Church in Seongbuk-gu District, Seoul City, we have 18 additional cases being confirmed. In total, we have 933 cases being confirmed. Among them, 567 are visitors of the church and the worshippers, and this has spread to about 325 people through nth transmissions. And we are also conducting our epidemiological investigation. And by age group, 60s account for about 25%, and 70s, they also are about 130 cases, and we have the majority of them being in the 60s. And we have also confirmed 23 venues that have been related to further transmissions from this church. 8 of them were churches, and they also included nursing hospitals and office spaces. And we have found that 130 people have been confirmed right now through these diverse venues, and epidemiological investigation is underway for 186 facilities. And in relation to the Liberation Day rally, we have additional cases being confirmed. In total, we have 219 cases being confirmed to date. And in relation to a real estate auction firm in Junggu District, Seoul City, we have 4 additional cases being confirmed. In total, we have 16 cases being confirmed to date. And moving on to Incheon, in relation to Junim의 Church in Seogu District, we have the first case, index case earlier this month, and we have 28 new cases, and a total of 30 people have been confirmed to date. And in relation to a group tour in Gimhae, Gyeongnam Province, we also have the index case on 5th of August. We have additional cases there. We have a total of 9 cases being confirmed. And they also include 4 families in Gimhae. They went to Hwasun and Naju, and they also had close contact, including dining together. And we are also conducting our contact tracing right now. And in relation to Asana in the Busan, we also have additional cases being confirmed after index case being confirmed, and total we have 7 cases being confirmed to date. And here are some updates on our imported cases. Today, we have a total of 13 new imported cases. 3 of them have been reported at points of entry, while the other 10 have been reported through self-quarantine. And we have 7 South Koreans and 6 foreigners. And 3 were from Uzbekistan, 2 from Kazakhstan, and 1 from the US, and we have 3 from America and 3 from Africa. The KCDC would like to note that virus is spreading through multi-use facilities, including cafes and restaurants, and we are continuously witnessing cluster infections there, and therefore we have been urging the public to abide by quarantine measures. Lately, we have seen the multi-use facilities, and they include Paju Starbucks, 66 people have been confirmed in total, and 25 of them were users to the cafes, and also 38 were other transmissions. And we have analyzed the risk factor, and we had seen that they had a weak ventilation through windows, and they had also air conditioning system installed in the ceiling. And we have seen that there was an index case who visited the space for about 2 hours and did not wear face masks properly when consuming beverages as well. And we have also shown for the analysis, we have the 4 managers were not infected, and also about 60 people on the first floor. There were no infections on the first floor, and we have seen that out of the 120 people on the second floor, a majority of them were infected there, with the positivity rate being at 21. And in relation to the Lotteria meeting, as well as cafes in Yangjae-dong in Seoul, as well as a restaurant in this area, we are continuously witnessing cluster infections through such multi-use facilities. Epidemiological investigation shows that the major risk factor was an increased use of AC due to the hot weather, and they did not have proper ventilation. And as these places were crowded, they did not have proper distancing measures between the users. And as for the users, when they are engaging in lengthy dialogue, they did not wear face masks, and therefore we also saw a high risk of infections through the respiratory droplets. As for the managers for these multi-use facilities, they wore face masks, thus reducing the risk of infection. And please note that at cafes and restaurants, it is difficult for users to wear face masks at all times, and we also would like to ask you to comply with quarantine measures if you visit these places. And instead of eating inside, please utilize delivery services, or please take your food out. And also avoid visiting these places at crowded hours and minimize your time of stay. Moreover, you need to keep 2 meters of distance, and aside from the time when you are eating and consuming food, please wear your face mask and minimize your time of stay, and also have your face mask on at all times, even when you are engaging in dialogues. And the KCDC would like to also note that we have conducted accepted 129 patients, and we have accumulated their genetic schemes, and we have seen that out of the 129, 105 were domestic infections, and 24 of them were foreign imported cases. And we have seen that in the up till April, we have SV group, and also in starting from May, we are seeing a variation of a virus, and in Africa, GR virus is also spreading, while in the America, we are seeing GH group strain. And in Korea as well, we have S and V group in the early April. However, after May, we have seen no longer S and V group being witnessed here in the patients in South Korea. And through the Gyeongbuk, Yecheon, and Itaewon case, we have seen GH virus strain being detected here in South Korea. And in relation to the Sarangjil Church in Seongbuk-gu District, Seoul City, and in relation to the Urijeil Church in Yongin City, Gyeonggi-do Province, we have confirmed that their virus strain was GH. And as for the cases of imported cases, the virus strains were different from their destinations, and most of them were GH and GR group. And lately in Busan, we have seen a cluster infection from a Russian flagged ship, and also this has spread to Bugyong High School as well as a mechanical school there. We have seen GR group spreading at these clusters. And the KSDC also would like to note, and as for the disclosure of the information on the confirmed cases, we had detailed discussions with the local authorities, and we ask for them to be careful when they disclose all of the information in relation to the confirmed cases. We have seen that there were 35 cases of breaches of the information disclosure, and they included the gender and as well as their age and the period of the disclosure, and also the address of their residence. And all of when we disclose the information of the confirmed cases, we do not disclose all of their information. Rather, we focus on those that the public needs to know for the purpose of quarantine. So we need to protect the privacy of these individuals at the same time. Therefore, we only disclose the information that are needed for quarantine and also containment of the infectious disease. And we believe that if we disclose too much information, this could also bring a stigma on the confirmed cases, which could also hinder people going to get tested, and this could also lead to a very big chaos in the society. And we also ask the members of the public to refrain from also disclosing these information through online means, including portal websites as well as blogs. And we also advise them to disclose only necessary information and to delete those information after a certain period of time. And lately, we have seen great issues of a great compliance to the social distancing measures to curb the further spread of the virus. And we ask you to comply strictly with the level 2 social distancing measures. And aside from making non-essential visits, please refrain from making your outings and gatherings, and please postpone your plans of travel as well. And when you visit restaurants and cafes, please utilize the delivery and takeout. And when you are working out, we advise home training or outdoor exercising rather than going to indoor gyms. And for social activities, utilize PC and smartphones to have online meetings. And if you are going out, wear your face masks at all times. You need to cover your nose and mouth properly. Moreover, you shall not touch the mask surface, and so please abide by these guidelines and keep your masks on except for the times when you drink or eat your food. Moreover, please do not go to closed, confined, crowded, close contact environment that have poor ventilation. If you have fever or respiratory symptoms or muscle pain, please refrain from going outside. Please do not go to work. And if your symptoms persist, please call our call center or get tested at a nearby screening clinic. And centering around the metropolitan area, we are continuously seeing a cluster of infection going on, and we have seen it since the 18th of August. We have seen on a daily basis more than 200 patients on a daily basis, and right now 3,585 people are in quarantine, and the number of those with severe or critical conditions are also increasing. We have greater concerns over the fact that we have a bigger portion of these people with critical conditions because we have more age distribution of the confirmed cases in their senior age group, and we have seen the virus spreading through family members, and thus elderly people are also getting infected as well. And we have also seen many hospitals that have to close down their ERs, and also they need to put their doctors and nurses on self-quarantine due to the spread of the virus. And this is leading to a great medical vacuum. And as for the hospitals as well as nursing homes and nursing hospitals, we have a higher risks of infection at these places as well. Right now, we need to flatten our curve so that we can also refrain from having a medical collapse and to avoid many of our senior citizens getting contracted with the virus. So we need to exert our full efforts to continue to comply with social distancing measures. And for the next 2 weeks, that is, we ask you to refrain from and minimize physical contact with others unless they are essential travels, including going to medical care and buying necessities or going to work. The quarantine authorities will also exert our full efforts to reduce our fatality. Thank you very much.
Right, that was Jong Young, the head of KCDC, with Wednesday's afternoon briefing. So, do give us a gist of her address.
Sure. First, the hotspots of infections here in Seoul. There have been reported 18 new cases related to the Sarang Jail Church, raising the total to 933, and an additional 26 cases related to the Gwanghwamun rally. And Jong had a specific message regarding coffee shops and restaurants because it looks like more air conditioning led to less ventilation there. That's why she asked for the people to go for takeout or delivery and try not to stay too long, and when eating or drinking, not talk to other people.
Right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, Korea's Scholastic Ability Test has been rescheduled for the 3rd of December this year, as our Hong Yoo mentioned earlier. Whether or not the test will proceed as planned is anyone's guess, given the raging pandemic worldwide. Yet regardless of this reality, relevant officials have come up with a creative way of offering test takers vital information about college entrance this year. Do take a look.
Due to the effects of COVID-19, high school seniors here in Korea are facing a number of hurdles in their preparations for college. With social distancing and other preventive measures making it difficult for students to partake in extracurricular activities, some universities are changing their student evaluation criteria to remove extracurricular participation. Amid this backdrop, the city of Gwacheon held a drive-in college entrance information seminar to minimize the risk of infection for students and parents alike.
코로나19 상황이지만 학부모님들이나 이제 수험생분들의 뜨거운 관심과 또 입시 설명에 관한 욕구와 그런 갈증들이 있으시기 때문에 저희 과천시에서 방역과 관련해서 입시 설명회를 하는데 어떤 좋은 방법이 없을까 생각을 하게 되어서 저희가 드라이브-스루 형태의 입시 설명회를 개최하게 되었습니다.
Even COVID-19 has done little to deter the education fervor among students looking to enter college. Cars begin to appear one by one before the seminar is scheduled to begin. But all visitors must go through a basic screening procedure first.
안녕하세요. 체온 측정 좀 하겠습니다. 36.7이요. 네, 적어주세요.
To prevent any possible infection, screening centers have been set up at the site, along with sterilization kits containing disinfectant wipes and face masks. Vehicles are also spaced apart to further minimize any chances of an infection. The parking lot is soon packed with scores of vehicles in no time. The information seminar has now begun, and the participants tune in to a designated radio frequency to listen into the seminar from the safety of their own vehicles. Both students and parents listen intently, wearing a serious look.
지금 특히 이제 3학년들은 학교 수업이 많이 부족하고 그러다 보니 좀 부모들도 조금 불안한 감이 있고 아이들도 조금 많이 불안한 게 있거든요. 근데 이렇게 행사를 진행해 주셔가지고 정말로 도움이 될 거라고 기대가 됩니다.
Despite these radical changes amid COVID-19, the pandemic has done little to discourage the nation's drive for higher education, as evidenced by the people gathered here deep into the night.
올해 코로나 때문에 학습 부담도 굉장히 컸고 수시 변화도 좀 있기 때문에 학생들이 상당히 고민이 많을 텐데요. 나만 그런 게 아니라 모든 학생들이 동등한 조건이기 때문에 너무 큰 불안은 안 가졌으면 정말 좋겠습니다.
Amid the resurgent COVID-19 outbreak here in Korea, additional measures are needed to ease the sense of anxiety being felt by students and their parents.
On the international front, Iran is one of the hardest hit nations in the Middle East, with health authorities there recording an average of roughly 2,000 cases on a daily basis. For more on the situation there, I have Rustin Radva, a freelance journalist in Tehran. Welcome, Rustin.
Thank you, Sunny, for having me.
Right, thank you for being with us. Rustin, let's begin with the overall COVID-19 situation in Iran then.
Yes, well, as per the official statement released by the Ministry of Health this morning concerning the COVID-19, there is the death toll currently is set at 20,900 people. And we have 29,500 active cases, which 13% of them have critical situation. And from the beginning of the pandemic, since early April, there is 363,000 people infected. And everything is kind of back to normal. I mean, it's not resolving at all, but businesses are open, people are going to work, but they need to taking care of the measurements by the government.
Rustin, Western media outlets have cast doubt on Iran's COVID-19 statistics, the statistics that you just mentioned, claiming that the numbers are inaccurate. What is the government's stance on these words?
Sure, too many people believe it because there is a little bit distrust in the number of the government, because they are trying to avoiding the public fear and panic, and there is not proper staff in the hospitals or in the Ministry of Health to give us the exact number, and this is the main reason why we cannot accept or deny the numbers that officially is releasing by the government.
I see. Rustin, I understand that the country's national university entrance examinations started early. Well, they were taken, that is, early last week. I believe that was the 19th of August. How did the exams, better known as the concours, if I'm correct, how did they go, and what measures were adopted to ensure safety there?
Well, there were too many discussions about if it's gonna be held in the same day or not, but at the end, the parliament members decided to holding it at the same time. Too many students and parents and even the authorities were against this decision because of the safety of the students. But with some measurements like social distancing, they decide to make it happen and not postponing it. And it's finally happened at the time that they were setting. But in the smaller cities, there were not enough. Doubt about.
I see. Rustin, I also hear that an annual religious ceremony is being held there, despite concerns by medical experts. Please tell us more about the Muharram commemorations.
Sure. Ashura is one of the most important ceremonies for the Muslims and in the Shia belief. And it's like one day per year where all the Muslims, all the Shia Muslims come around and gathering in the streets or indoors and mourning for the death of their third Imam Hussein. And they are chanting and trying to mourning for him. And this year, after too many discussions about if it's a good idea to make it happen or not, with the direct order from the Mr. President and the Supreme Leader, they said that it should be held in the exact time like the other years.
I see. Well, I hope you continue to have your safe commemorations. All right, Rustin, thank you very much for joining us live with your thoughts.
Thank you for having me.
주중에 태풍 바비의 북상도 예고되는 만큼 필수적인 외출이 아니라면 집에 머물러 주시고 실내 활동의 증가가 예상되는 만큼 실내에서도 마스크를 꼭 착용해 주시길 부탁드립니다.
Amid heated debate over the possibility of further raising social distancing guidelines to level 3, Typhoon Bavi is making its presence felt in the southern resort island of Jeju with strong winds and heavy rains. Capital Seoul is poised to come under its influence starting late tonight until Thursday. Now, along with prevention measures against COVID-19, authorities are also calling for safety against Typhoon Bavi. For more on this, I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute of Global Health. Welcome back, Director Kim.
Nice to be here again.
And I also have Professor Choi Young-jun from Hallyu University. Hello, Professor Choi.
Thank you for having me.
Right, Director Kim, I believe the proverb that comes to mind, and do pardon the pun, is when it rains, it pours. Do you believe the typhoon may affect the COVID-19 situation here in the country, and if so, how?
Well, it's a very difficult question. Usually it takes about 2 years of observation to make conclusion that COVID-19 is going to get worse after typhoon or it's going to be the same. The distribution of COVID-19 outbreak along latitude, temperature, and humidity is consistent with the seasonal respiratory virus. That means if the temperature rises, humidity rises, the COVID-19 might decrease, but we are facing an irony that it's doing the opposite. So we have to check it why it's happening. And for the issue of typhoon, usually we have to get some medicine or food or water before it comes. So it's recommended to get the home delivery and try to be with your family member or close friend who can be a caregiver to you. So yeah, another typhoon might come, and that should be our strategy.
Right. Professor Choi, I suppose it's only natural for people to choose to stay indoors in light of a typhoon, but this is precisely what health authorities have been cautioning against places that are confined and congested, indoor places, of course. Do you see the typhoon aggravating the COVID-19 situation here in the country?
Yeah, so there are a couple of angles that we can look into. Like there's some saying that weather conditions like the typhoons or the environmental factors would affect the spread of the virus. Or, of course, the human factors, like the behaviors, would directly affected by the weather conditions. Of course, in the case of the rain and storm, we tend to stay indoors rather than moving around the cities, right? So when there's more people inside the buildings, there are the accumulation of the infection pressures, so which might cause the likelihood of the spread of the virus. So I'm quite concerned of the news of the storm that is coming up.
I see. Director Kim, Korea noted a prolonged monsoon this year, a total of 51 days, if I'm correct. Do you believe, or do you suppose, this particular reality played a part in perhaps the resurgence of COVID-19?
Well, I think the strain is different from the previous ones, and I think do believe that it is called D614G, and as it mentioned, it's more contagious. Generally speaking, coronavirus has an incubation period up to 2 weeks, and for this specific strain, we don't know how incubation period is going to be different. And since we have a really rainy season, many people stayed indoors, and still we have a concern that COVID-19 might spread by aerosol. It's not concluded yet. So we have to use an air conditioning system which do not recirculate, and it's better to have some kind of disinfectant, and it's better to open the windows and exchange with outdoor air.
Right. Professor Che, are the more breathable KF-AD masks equally as effective as their KF-94 counterparts, which of course are more tight-fitting and they're quite difficult to breathe in amid the heat? Could you walk us through the effectiveness of the masks, different masks that is available for the public to use?
So now there are lots of evidences in different levels that describes the effectiveness of the mask in both the individual level and the public level as well. So, so the bottom line is that all masks do provide the equally effectiveness in terms of the protections from you getting infected or you infecting others in both ways, in both directions. So KF-AD or just any other surgical mask or dental mask would provide us similar effectiveness or the efficacy compared to the KF-94 or which is equivalent to N95 respirator. So because the driver of the transmission is usually the droplet, which is the size is about the 5 micrometers, which is very sufficient for the all masks to provide the filtration of these particles to move into the physical barrier or move out from the physical barrier.
I see. Director Kim, what are your thoughts on mandating face masks outdoors?
First of all, we have to remember that when we speak, the droplets reach 1.5 meters. If we cough, it will go further more than 2 meters, and if we sneeze, it's going to go further more than 6 meters. But when we are outdoors, the chance to get infected becomes less, about 20 times. So when you are outdoors, it's safer than indoors. And if people are moving in one direction, it's more safe than meeting people close by. So when you go outdoors, you have to take your mask. If nobody is nearby, actually you don't have to wear it, but if somebody comes close to less than 2 meters, you better wear it. And this situation is very different from whether it's windy or not, it's hot or humid, or how much people are crowded. So people have to decide when to wear the mask. And as I told you, you have to keep using the mask as much as you can.
I see. Very briefly speaking, Professor Cho, what are some of the classic symptoms of COVID-19? I mean, how can we tell it apart from the common flu?
So there are the symptoms of the COVID would be very vary from zero symptoms to very severe fever, chills, with cough, and usually like the respiratory virus infections like that. And of course, there are certain some symptoms that is specific to COVID, like the loss of your smell, or the diarrhea, or the nausea and vomiting. But I don't think there is a magic key or the sequence that would describe the COVID that is sensitive enough to differentiate with other viruses. So I think at this moment of time, if you don't feel good or if you feel sick, please, I think you should consult your doctor or the public health centers.
And then try to get yourself tested.
Right.
Director Kim, people here in Korea at this moment are not only fighting a pandemic, we also have a heat wave and now we have a typhoon. What are some of the safety measures to keep in mind amid this particular situation?
Well, I always emphasize on the high-risk groups. If you're aged more than 60 or 65, and if you're obese, if you have diabetes, if you have pre-existing lung or heart disease, if you have cancer. These kind of people belong to a high-risk group. And I had the chance to encounter an article named New Disease, Old Vaccine. And the conclusion was that if you have an MMR, which means measles, mumps, rubella vaccine, and it will boost our immunity, and it might have a chance that we have a stronger immunity against COVID-19. And also there's some article about pneumococcal vaccination also. So I recommend the people who belong to the high risk, go visit your physician and ask when you had the last vaccine. And if it's necessary, I recommend you to have the MMR or pneumococcal vaccine.
I see. So for those of people who have pre-existing health conditions, it's better to get some expert input. I see. All right, Director Kim, as always, thank you for your thoughts. And Professor Che, thank you for being with us today.
Thank you.
Right, on that note, we say goodbye for today. Now, do make social distancing a priority and do take care against the typhoon, which is bringing with it strong winds and heavy rain here in this part of the world. Also, do share your thoughts and inquiries with us through our social media accounts or homepage, arirang.com. Thank you for watching.